So a gastric bypass is an operation where we create a small piece of stomach and bring up a loop of the bowel or the intestine and join it to that small piece of stomach. There are two types of operations that we do for a gastric bypass. There's the standard or two-joint operation called a Roux-en-Y gastric bypass that's been around since the 1960s, and that has two joints. But there's a newer type of gastric bypass called a single joint or one anastomosis, also called a mini gastric bypass, and that's now been around for about 10 to 15 years. They both have their pros and cons, and that will... So who should have a gastric bypass? Well, a gastric bypass generally are reserved for patients with either significant reflux or who have metabolic syndrome such as bad diabetes, high levels of cholesterol, or high levels of hypertension or high blood pressure. But increasingly I'm using the gastric bypass in revisional surgery for patients who may have had either a gastric band before or a gastric sleeve and who now require revisional surgery, also called redo surgery. So these patients should be considered for a gastric bypass. But generally in my practice, still patients who are coming for their first operation, almost 90% of patients will have a gastric sleeve and 10% of patients will have a gastric bypass. So what are the risks with a gastric bypass? Again, there are the standard risks with any operation, but the specific risks of a gastric bypass are slightly more than a gastric sleeve. These obviously include bleeding, leaking from the staple line, but also the joints that we do as well. So obviously in a Roux-en-Y gastric bypass there are two joints. With a single anastomosis or a mini gastric bypass there's the one joint. So obviously leaking from these joints is a serious concern. But there are some other significant risks with a gastric bypass, including dumping syndrome, internal hernias where the bowel can then enter into spaces which are unnatural for that part of bowel and then can twist and then can cause bowel obstructions and abdominal pain. You can also develop ulcers at the joints that are done, and these are called marginal ulcers, and this can occur many years later after the operation and are particularly more common in patients who smoke. So generally, if patients are smokers, we try and avoid performing a gastric bypass. But these ulcers, if they continue to develop, they can then lead to perforation where a full hole develops and therefore patients can then leak gastric juice. Other complications include nutritional and vitamin deficiency, so it's important that patients who have a gastric bypass also continue to take their multivitamins on a daily basis. The main issue with a mini gastric bypass that patients do need to be aware of is bile reflux, and I'll discuss this in more detail. How long does the operation take? Generally these operations take a little longer than a standard gastric sleeve. A mini gastric bypass can still take between 1 to 1.5 hours, but a Roux-en-Y gastric bypass will normally take between 2 to 2.5 hours. But obviously the time taken will depend on the amount of adhesions, if the patient's had previous surgery, or if this is revisional surgery, which generally will take much longer anyway. So if you have any more questions, feel free to email me, but also please look at our website and I'd be happy to answer any further questions. Look forward to sharing some further videos with you. Thank you.